Hello and welcome to Lockdown Economy Nepal, a local edition of a social nonprofit initiative to help small businesses and self-employed professionals overcome the challenges of the pandemic. In Nepal, it is being done in collaboration with NYEF Kathmandu chapter, a membership-based nonprofit organization dedicated to create outstanding entrepreneurs, and AlterContacts, a global think tank for sustainable development based in Amsterdam, Netherlands. My name is Susan Lal Manandar, host of the interview series, and I'd like to welcome everyone who has joined us for this session. Today, my guest is Mr. Aabhushan Jyoti Kansakar, who is the founder of Jeevee Health. Hello, Aabhushanji, how are you?
Hello, Susan. I've been well. How are you?
I'm well, and I'm really excited to have you on this interview series. So, before we get into the questions itself, please tell our audience about Jeevee Health and its services.
Jeevee Health, or Jeevee, is a health tech company. We operate in the health technology area where it's a one-stop solution for health health services in Nepal. Uh, we provide various services ranging from you can book a doctor's appointment from our app at a clinic or hospital, or you can book an appointment online with a doctor, get on a video consultation with the doctor, where the doctor can prescribe you your medicine, advise you on our platform itself, which gets stored as a personal health record on your mobile phone. Um, Apart from that, we deliver these medicines to your homes. Um we operate in 23 cities around the country. Apart from that, we have a smart diabetic solutions for diabetes, smart diabetes management solution, where you can where we have a smart glucometer connected with your mobile devices, where all of your data are all stored, uh, and you can analyze your blood sugar based on your various data, historical data, and manage your lifestyle accordingly. Apart from that, we also do a lot of other services like vaccination camps and etc. Through the app itself.
That's wonderful because, of course, during the lockdown, a lot of things stopped. But one of the major things that can stop is health services because people still need access to their prescriptions. They still need to meet their doctors. And your app allows them to do a lot of this digitally. And like you just said, you operate in 23 cities. So it is a very widespread service as well. So, uh, Aoshinji, what was business like for you before the lockdown?
Just before the lockdown, we're basically 3 months old. 3 or 4 months old. We started operations in November 13th, 2019. So when the lockdown happened around in March, we were hardly about 3 to 4 months old. So we were just learning the ropes. We were still looking how we can scale. We are focused on the users. We are focused on how to grow these users. Obviously, it was just normal business at the time. Expectations were obviously for a 4 month old. There was a certain set of expectations from us, but then it was moving fine. We wouldn't say we were disappointed or we were not happy with it, but then yes, it was moving fine. Until the lockdown when things started moving very differently. Yes.
Of course, then the pandemic was followed by the lockdown, and your app being in the health sector, you connect people who require health services and people who provide health services. And like you just said, you were only operating for 3 to 4 months before the lockdown. But to provide your services, you're working with a lot of vendors, you're connected to a lot of doctors. So, how did you maintain your relationship with your partners? What was your strategy during the lockdown to stimulate your business?
I think that's a very important question. Just before the lockdown, we had two services up majorly. One is delivering medicines to people's homes in the Kathmandu Valley, which is about three cities. That's where our services were located initially in the first 4 months. Apart from that, uh, we did online appointments with doctors at their clinics and hospitals. When the pandemic happened, one of our services were down. So obviously our users didn't have that service. What we realized is what we were giving during the lockdown, one of our various partners, one of our very important partner in this business are the doctors themselves. What we realized is even the doctors were going to lose their income. In Nepal, uh, they are self-employed. Their income comes in from these consultations, OPD services, and all of them closed down. So when we understood that, we developed the Namaste Doctor, which is basically a feature, the online doctor consultation feature, in 11 days. So we launched it in April. We launched it on April 3rd. The lockdown happened on March 22nd. The plan was to get it up in 7 days. My team worked day and night and got it up in 11 days. So that actually provided substitute income to the doctors as well. But I would have to admit the first 2 months, the doctor actually provided these services for free to the patients because they thought it was the need of the hour, and they actually provided it for free. And we actually enrolled about 30 doctors in the first 2 or 3 days itself, new doctors who wanted to provide online consultations. So that's how we started off during the lockdown. It wasn't necessarily a very easy time because I think our larger partner, again, uh, because we're not a marketplace, right? So which means that we don't have pharmacies that we pick up. We have vendors. The vendors were closed. So how do we deliver these medicines? So we did, because we're an inventory based model. We actually we had taken certain set of risks to actually stock these items, which actually helped us to go in the first 15 odd days. And during that time, I saw that we were the only ones who were delivering medicine in the first 15 days or 1 month across Nepal. The physical pharmacies were closed. Everybody was very scared. Nobody really wanted to open them up. Most of our competition, who were much older than us, really could not operate in the first 15 or 20, 30 days because they were a marketplace. So we were able to do that. We had to find ways how we get these medicines in our inventory. We had to find vendors. We had to go pick them up. Actually, our work doubled. The orders jumped 5 times, but we had to go really go and buy these medicines ourselves. So it actually, the work doubled, and we couldn't really expand the team because during the pandemic, there was no way that we were going to hire a new team, right? So there was a big difficulty when it came to that, yes.
That is an incredible story because, of course, in a situation like this, it is very easy to overlook some of the stories of the startups and how they are innovating during these times. And sometimes these innovations can be really creative, like you just said right now. And also another thing you mentioned was during the pandemic, your work doubled. So I'd imagine that in this situation, more people were inclined to using your services because everything is digital. So did you see a spike in the number of users as well?
We did. We did see a spike in the number of users. It was the kind of spike for any startup or even any business operating in this kind of line. It's good to say, oh, we've got the orders, or we're getting new orders, but it's really difficult to actually fulfill these orders. The orders jumped by about 5 times. The first 15 days, we really could not catch up because, like I said, we could not really ramp up our team members. We had to manage at the same time. My team, for almost 1.5 months, worked from 9 a.m. to 9 p.m. to deliver these medicines because nobody else was at that time. We understood that it was necessary, but we also, during that time, we had to optimize our service, our operations really well. How do we get from 1 to 5 by just increasing 3 to 4 hours a day? It was still not possible, right? So we had to optimize our operations. We had to understand how we are going to pack these goods, how we're going to invoice these goods. We had to go through a lot of that. I think kudos to my team, basically. I think they worked really, really hard, whether it's my engineering team, which actually developed an app developed a complete feature, which is basically a messaging or a video feature in 11 days, or whether it's my team who are delivering X amount of packages, started delivering about 5x amount of packages in the same amount of time. It was a challenge. It was interesting. As a startup, that is what we, I think, we live for. We live for all of these. This is the kind of excitement that we live for. It's difficult, but yeah, it was very exciting. Yes.
And like you just mentioned right now, your team showed incredible spirit during the pandemic, and even when the work doubled, they really backed the company. So working in a situation like this, it can be very stressful, of course. There's a pandemic going on and everything. So how did you keep the morale up of your teammates?
I think I've got a very, I would have to say I'm very lucky with the team. I've got a very, very energized and motivated team. I think a bit of it is also because they understand that they're working for a Nepalese business. It's completely funded by a Nepalese. there are no FDIs, and we don't plan to bring in FDIs into this business because we want to believe this is a homegrown company here. They know they were working for a homegrown company and how we can grow. I think they're in on the vision. They really believe what we are doing, and I think that is what kept going. I've got an amazing set of team members, managers who keep their team motivated. And again, motivation isn't just not enough. They just got to believe in what we're doing, and I think they believe that we were serving the community. If we did not bring these medicines to people's homes, they could suffer even more. They understood that. So they were delivering till 9 p.m. in the night. And you would have to know that we had a lot of rains, and actually a lot of rain during the April season this time. And they were delivering, getting completely soaked. So I would really, every 15 days, I always go to them and, guys, you're doing an amazing job. Thank you very much. I thank them tremendously almost every 15 days because I don't think I would be able to do what they do sometimes, you know.
This is really inspiring. I think you're operating with a very good value in your company. So with these strategies in place, now that the lockdown has been eased, how is your business performing right now?
I think after the first lockdown, our orders fell a bit because obviously I think people started hoarding the medicines, etc., because it was uncertain how long this was going to go. But after the second lockdown, which lasted about 3 weeks, after that, our orders have the number of orders have been increasing daily. It has not really fallen. I think there is a repeat customer that we have a lot of repeat customers, and the repeat customers love our service. They really thank us whenever they do, whenever they can. Our app ratings also show us for a startup. It shows how well they've liked our service. Apart from that, I think we've expanded. We've tried to expand to 23 cities. That makes us the widest delivery network for any e-commerce in Nepal. And this is against e-commerce which are funded by foreign companies, very well-funded e-commerce companies, as well as these companies which have actually spent 12 years or more in the country, right? So being able to do that, and probably in next 1 month we plan to get to about 50 cities, because I think if you actually look at the geography of Nepal, a lot of these medicines that we deliver in Kathmandu Valley is not easily available in many of these places, and it's essential. So I think that is what drove us to actually do this. So that's what we are working on this year.
So like you just mentioned, in the next 1 month, you're planning to go and expand to 50 cities. Actually, my next question is related to just that. So what is the outlook for Jeevee for the next 3 to 4 months?
I think we'll be expanding to about 50 cities. We've got the online doctor consultations, which is doing tremendously well now. We do about 24,000. We have already done 24,000 plus consultations. We want to get to somewhere close to about 500 to 600 consultations a day. 500, 600 constant consultations a day by next month, and 1,000 consultations by probably end of December. That's what we plan to do. Once we're able to do that, I think we will be moving a lot of people. I think there was a simple calculation we were doing, and then we realized as a company what we have done. We've saved 448,000 kilometers of trip for people, which saves somewhere close to about 448 kg of carbon emissions in the country at the moment, and somewhere close to about 900,000 patient contact, the contacts they would have at various clinics, right, and hospitals with various people. So that's the amount of impact we've had in this so short period of time. I think the pandemic is going to be there for the next 2 or 3 months, and I think as Jeevee, most of my team members were very dedicated to make sure that we go out there and actually make a big impact when it comes to saving lives, or making people's life healthier, and making healthcare actually available. And one thing what I failed to mention is actually it's 50 cities for deliveries, but we are actually available countrywide for video consultations, and we have actually done video consultations in at least more than about 100 cities and towns. We've actually been able to do that.
Once again, it's a very incredible story because, I think a lot of viewers who are watching us right now who are aspiring to be entrepreneurs, they can get a lot of insights from what you have done during the pandemic. But because, like I said, again, you were only operating for 3 or 4 months before the pandemic, and whatever strategies you had to develop, you had to do in such a short amount of time. And I think that can be inspiring for a lot of viewers who are watching us. So, Aabhushan ji, this is my final question to you. If you could point out 3 areas in your business that you need help with, what would they be?
I think scaling my business is always going to be difficult. I think uh, any 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 kind of help would obviously be helpful. But yes, we are scaling up. But then it's a lot of what I would say is we're trying to learn. We are learning as we go. So we make a lot of mistakes. We lose a lot of valuable time when you do that. But in a way, that's what is fun for a startup. If you don't learn, when you don't fall, you don't really enjoy. I think as entrepreneurs, you always enjoy a few failures because that teaches you a lot. So I think that's what it is. But that's one area that I think in terms of the scalability, I think if we could move faster because of that. A few things, investments, etc., is always going to be a bottleneck for countries here. But then we want to make sure this is a homegrown company here in Nepal, where FDI, because there is a lot of limitations with FDIs in the country. So it should not come and hamper such things. Obviously, there's a big question mark in terms of the regulatory policies by the government, which, especially with the health sector, that brings in a lot of difficulties. Obviously, help in bringing the right set of policies so that it can help digital health move further, so that healthcare services are, I would say healthcare services available in even the remotest part of Nepal. Today, building large infrastructure, building billions of dollars, spending billions of dollars in building roads to connect only 2 or 3 cities, you could do a lot more by actually building companies like this, which does not require billions of dollars, and you can actually make healthcare accessible to a lot of people in even the remotest part of the country today.
So I think you just mentioned a very important point over here, which is actually a life lesson, not just for entrepreneurs, for anybody really, because a lot of people look at failure as a dead end, and it doesn't have to be a dead end. It's a learning curve, and you can learn from that, and you can put your learning in practice, and you can get better. So I think it's a very good point you just mentioned right now. And regarding the other areas you just mentioned, I'm sure there are viewers who want to collaborate with you and want to come up with creative solutions. So all the best for that as well. And thank you, Aabhushan ji. This was a wonderful time. I'd like to thank you for coming on this interview series and sharing us your insights.
Thank you so much, Susan. I think I had a wonderful time. I was very excited for this interview, particularly. The last time I spoke to you, I think I was like, okay, I think I'm going to have a great time having, talking about this. I hope I didn't talk about myself too much. And thank you, Susan, for this wonderful opportunity.
Thank you again, Aabhushan ji. And thank you to our viewers who joined us. If you have any question for Aabhushan ji, his contact will be in the description, or you can leave a comment in this video. I invite you to like this video, share it with your friends, and follow our page, the NYEF Kathmandu Chapter Facebook page. A recording of this video will be present in the AlterContacts YouTube channel, so please subscribe to our channel. There are playlists of videos where entrepreneurs and business owners from different parts of the world have shared us their insights. We'll have many more interviews like this in the upcoming weeks, so stay tuned and goodbye.